Back pain is the largest single cause of disability in the UK, with low back pain alone accounting for 11% of the total disability of the UK population. One of the main reasons why we have made this video is because patients with back pain are often given conflicting messages and advice regarding their back pain, which can be very frustrating and raise people's uncertainty and anxiety about what they should be doing. After watching this video, we hope that you will have significant information and be able to follow first-line advice so that you can improve and more successfully manage your back pain symptoms.
I had back pain from quite some time ago and I had a car accident and unfortunately it has worsened over the last few years as I have a disabled son, so it needs a lot of hoisting, a lot of moving, a lot of movements that you wouldn't normally do with your back, and hence my back pain just got worse until the point where I felt I needed to do something more serious about it. When I went to the doctors to talk about my back pain, he felt it was muscular and nothing that could be done particularly with regard injections or operations, so it was purely to go and see a physiotherapist and get some advice and an exercise programme, which is when I was referred to South Petherton Hospital to a physiotherapist, and she said to me that there was a new group starting up at South Petherton Hospital, particularly for people with back pain. Would I like to go? And which I said, yeah, well, yes, because I think I would need that commitment every week, and also you've then got someone who's guiding you in the right way. My back pain is much improved since I've been going to the gym. The physiotherapist talked through my back pain, how was it affecting my life. He then set me targets of what I would like to achieve at the end of the course. He then set me some exercises specifically for my back pain. So I had to go away and every other day do the exercises. Then once a week we went to South Petherton Hospital with about 3 or 4 other patients who had different exercises depending on their back pain, and as the weeks went by my pain became easier, but it was very painful at the beginning, and then you do question, well, is this the right thing to do? But I have to say my balance got better, the pain got less. I find the easiest things are walking the dog, keeping active. I pace myself, I do things in short stints rather than, oh, I feel good today, therefore I'll do all of this work and then I can't move the next day. So I found that I do things a small bit at a time, and I have met all my targets that the physio set me, but I haven't stopped doing the exercises, because I find if I do stop doing the exercises then I seize up. What's important to me is I just keep doing the exercises to keep the pain as low as I can, but not go too mad and do too much in one go.
Back pain affects many people in their life. About 80% of the population will experience back pain sometime. Thankfully for most of those it's a relatively minor thing that will trouble them for a short time, and they can usually manage it themselves. As a spine surgeon, I tend to see the people where back pain is more intrusive in their life. And the first thing to say is that the severity of your back pain does not always dictate the severity of the cause. There are many, many people who have very severe back pain with nothing horribly wrong in their back, and it understandably upsets them and distresses them and affects their lives, but it's been very difficult for the medical profession in general to find a solution to that. We have a group of worrying symptoms that we call red flag symptoms, where you should seek an assessment by your doctor or through the musculoskeletal service. And those include constant unremitting night pain, loss of appetite and loss of weight, if you've had a history of a tumour in the past, or if you get neurological symptoms with your bowel or bladder or in your legs. But generally the vast majority of people with back pain don't experience that, they just experience pain on motion. People who experience pain on motion think sometimes that it's their body telling them to stop. Back pain's not like that. Unfortunately, back pain is really your muscles and joints complaining about what you ask them to do, and they can complain a lot about them. Slightly counterintuitively, keeping active and undertaking exercise is a good thing in back pain. And if you stop activity, it doesn't usually help your back pain, and generally you decondition your muscles and the bits of your body in the musculoskeletal system, and you find that your pain will often get worse over the long term. So understanding that if your muscles hurt, keeping your activity on is not going to damage you is really important. Back pain is very rarely associated with damage, and because it's not usually associated with instability in your back or anything horribly going wrong, we found that the surgical operations that we've used in the past to try and treat back pain, such as fusing segments of your back pain, haven't really worked in most cases. And now spinal surgeons have moved away from these operations as a solution for back pain. Generally, as a spinal surgeon, I'm pretty good at treating pain like sciatic pain or pain from pressure on your nerves, but that old euphemism, the trapped nerve, doesn't cause back pain. It causes pain in your limbs. And so if you have pain in the lower part of your back radiating out across your back, that's not because something is trapped in your back. It's really, again, because your muscles, your joints, the soft tissues in your back are saying, ouch. And that doesn't mean that there's any nerves trapped there. And that means, as a surgeon, me trying to untrap your nerves won't make you any better. The vast majority of people who have back pain need a simple solution, which is taking simple analgesia, keeping moving, and this often is helped if it's supported by some talking therapies or some psychological support, which your practitioners in the community or your general practitioner may be able to provide for you as well. Because there's lots of people in society who have back pain, naturally lots of people consult their GP, and because doctors and many practitioners don't know the answer for back pain, it's very common that lots of people will be given somewhat euphemistic answers. It's a trapped nerve in your back, it's your muscles, it's your discs, and lots of people will look for an answer. And then usually what they ask for is imaging. And the two common forms of imaging that have been used for back pain are the X-ray and the MRI scan. Now, for a long time, we've said that X-rays in back pain aren't really very useful. They only show the bones, and there has to be something very wrong with your bones, i.e. a fracture, if you're going to get any answer from an X-ray that explains your back pain, and fractures are actually incredibly rare, and they would usually follow an episode of trauma. So usually your practitioner will reassure you about that and suggest that we don't do an X-ray. MRI scans have been around for the time that I've been a doctor, about 20 or 30 years. And when MRIs first came out, we saw all these wonderful pictures of what people looked inside, and we started leaping to conclusions about what they show. And the central part that you see on a lumbar MRI scan is the discs. And discs can look very different from each other. So lots of crusty old spinal surgeons like me looked at these initially and said, oh, that's interesting, there's a dark disc there, or there's a bulging disc. And they started telling people, this probably is the cause of your back pain. Interestingly, over that 20 or 30 years, we've done lots of research into bulging discs and dark discs, and we still haven't come up with an answer for back pain. And when we've tried to do operations on the disc for back pain, they've largely failed. So we've stopped doing that now, and from 2016 the NICE guidelines are that we shouldn't do operations for back pain unless we have a very, very specific target, and that's very rare to find on an MRI scan. An MRI scan is essentially a picture of what you look like inside. And if you put a picture of yourself when you were 10, 20, 30, 40, 50 next to each other, we'd see a change in that. And we wouldn't call that pathology, we call that natural aging. And what we're discovering now is that most of the changes that happen actually from our teenage years onwards on MRI scans are simply the normal aging processes. And we know that because we've started to look at many MRI scans for people who don't have any pain, and we've compared them to MRI scans for people who do have pain, and largely they look the same. So it's very difficult for us to discriminate targets when all the changes that people may tell you are on your MRI scan, and they might be in your radiology report, and people who don't look at MRI scans very often might say to you, oh, you've got this bulging disc on your MRI scan, maybe that's the cause of your back pain. When you come and see a spinal surgeon, the spinal surgeon will tell you that, well, most of the patients without pain have those as well. So I can't really do an operation on that disc and expect to make you better. So MRI scans are useful for excluding really serious causes, maybe associated with those red flag symptoms we talked about, but it's very rare that on an MRI scan you'll actually see a target for back pain. So MRI scans end up largely for spinal surgeons as a tool of reassurance for patients to say there's nothing wrong. Some patients will go on and have an MRI scan later, but those are usually fairly selected patients that will usually be selected by your clinicians if your initial program of treatment hasn't helped at all, or if they're worried about you, or if things are deteriorating. And rehabilitation programs, when you're engaging with those with your physiotherapist or with your GP, are hard work. I often describe to people that rehabilitation is like a journey up a mountain. We all want to be on top of the mountain, out in the sun, wonderful view, no pain, living life. And that's what we look at, and that's what we stare at, and that's what we aspire to achieve. And we start off in the deep, dark, cold valley of pain. And like a journey up a mountain, there'll be some ups and downs on the way. And sometimes when we're on that mountain, if we keep staring at the top, we're trying to get to the top saying, when are we going to get to the top, when are we going to be pain-free? That's actually a bit negative in your rehabilitation. It's quite important to keep in your mind where you've come from and how you may be progressing, rather than keep staring at the top of the mountain. Because if you don't have a check on the way and look back into the valley, then things can be quite negative for you, and the fact that you still have pain can often make you give up on that rehabilitation journey, because it is a long, hard road. However, most people who stick to it will get to a place on the mountain where they've got a pretty good view, even if they're not at the top, and they'll get to a place where they can live their life. They can look after their family, they can go to work, they can do the things in their life that they enjoy, that maybe their back pain had taken away from them because they were worried that by continuing those things they were going to damage themselves. Now, walking up a mountain is hard work, and we'll probably get some pain when we do it, but we don't always think that that pain is damaging pain. So it's a similar situation with back pain, because the pain that we experience on our rehabilitation journey is not damaging pain either.
So, what should you take from this video? The severity of your back pain doesn't always dictate the seriousness of the cause. There are a set of red flag symptoms that if you were to experience those, you should seek urgent medical advice. Staying active and fit is the best thing you can do to help and prevent back pain. The majority of the time, surgery to treat back pain doesn't work and is no longer recommended as a treatment option. X-rays aren't very useful when it comes to finding the cause of your back pain, unless there's been a fall or other trauma to check for a fracture. MRI scans are useful for excluding serious causes of back pain, which are rare. MRI scans tell us what your spine looks like, but don't often tell us why it's painful or which part is painful. If you have been asked to watch this video by your physiotherapist or other clinician, then please ask for further advice if you have any questions or concerns. If you have not seen a clinician about your back pain and you would like to, then please contact your GP practice, who will be able to direct you either to the first contact practitioner in the practice or to physiotherapy for advice.